Hi, my name is Dr. Eliana Ramirez. I'm a licensed independent social worker, trauma therapist, and researcher of racial and LGBTQ related workplace abuse. I use she, her pronouns. I'm about to share several trauma therapies that may be of use to people who are recovering from workplace abuse. Before getting into that, I want to give a description of this video for people who are accessing it and living with blindness. I am a light-complected mixed-race woman of Mexican, Irish, Czech ancestry. I identify as cisgender. I have long brown hair, which is in a braid draped over my right shoulder, which appears to the left to the audience. I have silver streaks in my hair. I'm wearing burgundy cat eye glasses, red lipstick, and I have multiple silver hoop earrings and a silver ear cuff. I'm wearing a black button down collared shirt and a silver and black necklace. The pendant is in the shape of a circle. There is a silver tree in the middle with a black background. I'm sitting in front of a blank cream colored wall. Behind me are green plants in white and silver pots. And for a burst of color, there is a pink fuchsia blooming orchid with green leaves behind me. Okay, let's get started. So I have been studying workplace abuse for many, many years. My dissertation was looking at, just pull up my slides here. You can see it appropriately. My dissertation was looking at trauma and recovery among LGBT service members and veterans who served under anti-LGBT military policy. For several years after that, I addressed issues of burnout and compassion fatigue in mental health and behavioral health providers, as well as clinicians across healthcare systems. I recently published a study on the impacts of stress hormone flooding for pregnant workers in abusive workplaces, looking at the health impacts to the pregnancies, to the babies who survived the pregnancies, as well as to the employees. And horrifyingly, there were significant injuries that will last the lifetime of those babies, as well as the employees. The good news is workplace trauma recovery is possible. Our brains are wired to heal. Our bodies are designed, our endocrine system that releases different hormones, they are designed to balance following chronic stress and even trauma. So today I'm going to be sharing two of several different approaches to healing the injury to our brains, minds, and bodies. I'm distinguishing between brain and mind because the brain, and I'll show you my handy dandy brain model. So the actual brain here, it has a left hemisphere and a right hemisphere. And when you open it up, it has different regions of the brain. So the brain structure, these regions actually change when they are flooded by stress hormones on a chronic level. So that's the brain structure and function. The mind are the thoughts, the feelings, our identity. So workplace trauma changes the actual brain structure and function by affecting the prefrontal cortex. This is the thinking part of the brain. Many workplace abuse survivors will say that they have challenges with memory, problem solving, grasping complex information. That has to do with the actual brain structure. They might also start to have a trauma response to neutral stimuli, like the sound of an email notification coming in, or when they log on to Zoom or Microsoft Teams for an online meeting. They might feel rapid heartbeat, shallow breathing, they might feel flushed. So bodily reactions that have to do with the amygdala, which is the brain's alarm system, getting stuck in danger mode and reacting to neutral stimuli as if they're in danger. So that's the brain. The mind part has to do with how workplace trauma can impact our self-esteem. It can cause us to doubt ourselves. It can create a negative self-image that we are somehow defective. It can create significant shame and grief and complicated loss. When a person has a major injury, maybe they've been in a car accident or they are healing from a surgery, commonly people will come over and bring a casserole or send a get well card. That doesn't happen after the trauma of workplace abuse. Oftentimes, people who survive workplace abuse feel stigma. They are hesitant to tell other people what happened to them because in a toxic capitalist society, our worth is oftentimes equated to our work. And you can see this when people introduce themselves to one another. They'll say, "Hi, I'm so-and-so. This is what I do for a living." Or, "Oh, it's nice to meet you. What do you do for a living?" And so even though workplace abuse is extremely common, about 47% of workers in the United States will have at least one experience of workplace abuse, either targeting them or they will be witness to another person being abused psychologically in the workplace, both of which can lead to anxiety and depression. And in severe cases, post-traumatic stress disorder, PTSD. It can lead to coping behaviors of using too much drugs or alcohol. It can also lead to nervous system collapse, where people have thoughts of self-harm. They're in so much pain, they cannot think of an alternative other than to end their own lives. These responses, as tragic and extremely painful as they are completely normal. And what I hope you will get from this short video is the message that workplace trauma recovery is possible. We can heal our brains, the actual physical structure. We can heal our minds, the negative thoughts that we end up developing about ourselves and other people. And we can heal our bodies, the ways that our nervous system becomes dysregulated, the ways that our endocrine system, our hormones become imbalanced, and the ways that our immune system becomes out of balance, leading to increased risk of chronic health problems like diabetes, cancer, heart disease, which we know are associated with psychological abuse in the workplace. So today I'm going to be talking about two of several different ways that we can work on healing the trauma to our brains, minds, and bodies from workplace abuse. I'm going to be talking about neuroplasticity. That's the brain's natural way of healing the networks of cells in our brains that are called neurons. You can see on the left side of the screen here, that's a neuron. And so the brain is actually a very dense networks that are connecting different regions of the brain and different parts of the brain to one another. I'm going to be talking about neurofeedback, which is one way to work on that neuroplasticity. This is a treatment that I accessed in the beginning of my own trauma recovery. I'm also going to be talking about different psychotherapies that are evidence-based practices, meaning they're treatments, talk therapy treatments that have been tested on large groups of people to determine the extent to which they actually help to reduce symptoms of trauma, like nightmares and night terrors, avoidant behavior, the way in which some of us will avoid stimuli that remind us of the workplace abuse. It can also impact our ruminating thoughts, that we get stuck in these loops, repeating that abusive work meeting over and over and over again in our minds. So evidence-based practices means that the intervention was tested on a large group of people and it was found to reduce the symptoms that are associated with the trauma. I do want to share that unfortunately in 2025, there continues to be a lack of representation in those samples. So oftentimes, evidence-based practices have not been tested adequately on Black, Indigenous, and other people of color, on LGBTQ folks, on people who are living with neurodiversity, people who have physical health disabilities. The people who are oftentimes targeted by workplace abuse are underrepresented in the samples of evidence-based practices. The other caveat that I want to say from the get-go is that all of the trauma therapies that I'm going to describe today are for trauma in general. They're not specific for workplace abuse. I am in the process of developing an intervention for workplace abuse specifically, and I will be sharing that in future videos. But at this point, I'm just going to be sharing those evidence-based practices that have been found to be effective for trauma in general. So briefly, I want to explain that in future videos, I'll be talking about other ways to heal that brain, mind, and body injury from workplace abuse, including somatic practices that essentially are toning the nervous system. Strategic endocrine system engagement, so the ways that we are changing our diet, changing our thoughts and our behaviors to increase the likelihood that we will be releasing feel-good hormones and decreasing or interrupting that stress hormone flooding process. Also, I'll be talking in future videos about communal co-regulation. So activities that we can do with other people. It might be a support group. It might be practicing capoeira or drumming circles, sweat lodges, different activities that help us to co-regulate our nervous systems in community. I'm also going to be doing a video on ancestral cultural practices and cuisines that can help to heal the trauma again in our brains, our minds, and our bodies. Okay, before I get into the first two, the neuroplasticity and the psychotherapies, I want to just explain the difference between stress and trauma. So stress is a normal part of life. There's good adaptive stress, and then there's chronic dangerous stress. An example of good stress is when we are going into a work interview and we have a rush of adrenaline and a rush of cortisol. In a short time-limited period, that increase in cortisol and adrenaline can help us pay attention better, can help us focus on the interview questions. It can help us to create a response to the questions that is compelling. It can help us to engage more with our audience. Over time, if we have chronic stress hormone flooding day in and day out, 5 days a week, as is 40 hours a week, oftentimes the case for workplace abuse, and those hours in the evenings and weekends when we're spending thinking about and worrying about the abusive workplace, that's when that adrenaline and cortisol can end up causing health problems. We see inflammation, body-wide inflammation that ends up being the precursor to illnesses like heart disease, cancer, diabetes. The difference between chronic stress and trauma is that trauma is when our bodies and our minds are changing because we get stuck in a trauma response of fight, flight, freeze, or fawn, also known as people-pleasing. Dr. Gabor Mate has written about trauma as not the event that happened to us, but what happens inside of us. So again, the ways that our brains, our minds, and our bodies change in reaction to an overwhelming situation where either there was too much danger too fast and too soon, or a long period of danger when we had too little and support for too long. So when we are overwhelmed with a stressor or a danger that's either too fast, too much, and too soon, or we have too little support for too long in a stressful environment, both of those dynamics can lead to trauma. Okay, so neuroplasticity. It's so exciting that our brains, no matter how much damage has been done, either because of stress hormone flooding or because of a traumatic brain injury, like is common in car accidents, or, you might have heard about football players who end up having too much contact, head trauma. Both of those kinds of traumas can result in changes to the brain. I'm going to pull out my little handy dandy brain and show you that our brain has a left hemisphere and a right hemisphere. If we open it up, you can see that there are different parts of the brain. When we have chronic stress and stress hormone flooding, it actually changes the structure of the brain. So we have an amygdala, which is a small almond-shaped part of the brain that's kind of like the brain's alarm system. It either has danger, it senses danger, or it senses safety. There's no in between. When the brain is flooded with stress hormones for too long, the amygdala becomes overactivated and gets stuck in danger mode. And so it starts to react to neutral stimuli as if we are facing actual danger. When the amygdala is brought online, the prefrontal cortex, also known as the brain's CEO, goes offline. And this is a problem for many reasons, one of which is because that brain CEO, the prefrontal cortex, is involved in memory. It's involved in sense of self. It has a chronological awareness, and it's involved in problem solving. So when the amygdala is running the show and that prefrontal cortex is offline, it makes it very, very hard for us to problem solve, to think of alternatives. And that's where we see dangerous coping behaviors increase, where somebody is drinking more or using drugs more as a way to soothe the pain, or the nervous system collapses into a self-harming crisis where people think that the only way to escape the excruciating pain that they're in is to no longer be alive. If you have any of these experiences, you are not broken, you are not defective, you are extremely normal. You have been abused. When people are hit, it leaves a bruise. When people are psychologically hit, it leaves a bruise as well. It's just oftentimes not visible. And the good news is that through neuroplasticity, we can heal, regrow those neural networks. And as I mentioned before, we can work on balancing our nervous system and endocrine system and even immune system so that we can get back to a point where we can have rest and digest instead of the fight, flight, freeze, and fawn. Okay, so neuroplasticity is the way that the brain is constantly able to grow new neural pathways. You can think about Gabby Giffords, who was shot while she was giving a political speech. It left her unable to speak. She now is able to speak. The region of her brain, the Broca's region that manages speech, is part of what was damaged by that bullet. She relearned the way to the ability to speak by singing, because it's a different part of the brain that manages music and song. And so through singing, she was able to regrow the neural pathways in the Broca's region of the brain, the verbal part of the brain that had been destroyed by the bullet. The great news is that if you are lucky enough to live to 103 until your very last breath, you have the ability to regrow those neural pathways that were damaged by stress hormone flooding or by an actual physical trauma. Neuroplasticity, we can access it in part through neurofeedback. And this is one of the first interventions that I used for myself. Neurofeedback can be done in a variety of ways. I'm going to show you this. Actually, I'll stop sharing so you can see with a bigger screen what I'm talking about. Okay, so this is a neurofeedback cap. On the inside of it are nodes that are, when they're on the head, they read the electrical impulses that are going through those the neural pathways in the brain that I was just showing you. And so what happens is these little nodes pick up on the electrical impulse and then send the message through this rainbow cord to the end of the cord, which is attached to an amplifier. And that amplifier takes the data that's being collected by the cap and sends it to a computer that is running a neurofeedback program. There are also grounding leads that are placed on the earlobes. And so what happens is you watch a video of something that you're interested in, and when the brain is firing electrical impulses that we're trying to prune or stop, let's say the person is like ruminating, thinking about negative stuff really consistently, and you're trying to stop that from happening or condition the brain away from doing that. When the brain does that activity, the visual and audio on the video will go down. And so the person is straining to understand what's in the video. when the brain is doing what you want it to do, paying really close attention and not kind of like going off into, another world, so to speak, then the visual and the audio stay up. So it's encouraging the brain to grow new neural pathways in the way that you want it to, and to prune or let go, or let those pathways dry up that you don't want to have active anymore. So with neurofeedback, there's no medication. There's nothing going into the body. It's just encouraging through operant conditioning the brain to grow new neural pathways, and that target the regions of the brain that have been injured by the stress hormone flooding. I found neurofeedback to be extremely helpful for me. One potential side effect of neurofeedback is you can have headaches. I had headaches twice, and my therapist just changed the setting. I started to do a little bit less, so shorter therapy sessions, and then the headaches went away. Another drawback is that it can be pretty expensive. There are programs around the country, around the United States, that provide no cost or low cost neurofeedback. In fact, Los Angeles Unified School District is now using neurofeedback with youth who are from foster homes, who have significant histories of trauma and behavioral challenges in the classroom. Canada used neurofeedback with its Olympics team one year. They ended up taking more gold that year than any other country in the world, the year that they used neurofeedback to train their Olympians. So neurofeedback is really common, and it's used quite extensively in many other countries. It's just kind of becoming more widely known in the United States, probably thanks part to the pharmaceutical industry. And let's see, what else can I tell you about neurofeedback? I used it, and my children used it. My children, unfortunately, were harmed also by my workplace abuse. One of them was in vitro. I was pregnant with him while I was in the abusive workplace. And I recently published a study looking at the experiences of pregnant workers in abusive workplaces, and considering the health outcomes of both the pregnant worker and the pregnancy. So many of the women that I interviewed actually had miscarriages. There was also a stillbirth. And of the babies who were born, all of them ended up with physical and mental health challenges, as did my child. And but the neurofeedback was really effective both for me and for my children. Okay, I'm going to share a little bit more. We'll go back to our slides here. Okay, so we talked about the neurofeedback. So I want to share a little bit about workplace trauma and bodily wisdom. So I mentioned earlier that the amygdala, the brain's alarm system, that's that little almond shape in the center of the brain, kind of right behind like the ear area. When it becomes overactivated and gets stuck in sensing danger everywhere, that's when we can have a bodily stress response to neutral work stimuli. So it might be the sound of the email or instant messaging notifications coming through. It might be the Sunday night right before work starts. They call them Sunday scaries, when people start to have anxiety and panic attacks. They could be logging on to a virtual meeting platform like Zoom, Google Meets, or Microsoft Teams. Or it could be even just receiving a Microsoft Teams or other calendar invite, or seeing a colleague's calendar and realizing that they have been the target of workplace abuse, has been left out of virtual meetings or in face-to-face meetings. When these neutral stimuli can come up, then the body reacts as if it needs to fight or flight. And if we cannot effectively defend ourselves or get away from the danger, that's when we freeze. We start to have nervous system collapse. So many of us who are workplace abuse survivors will be exposed to a stimuli that makes our bodies do things like racing heartbeat, rapid and shallow breathing. We might start sweating profusely. We might start to feel flush in our face. The shoulders and the jaw can get really tight. We can have neck pain, jaw pain. We might be clenching our fists. We can have gastrointestinal problems like stomach souring, nausea, diarrhea. loss of appetite, or we can be craving certain foods that also have to do with a trauma response in the body. Um, Dr. Amy Apagian, who has written this incredible book, The Biology of Trauma, which is coming out in a couple of months here, she talks a lot about how certain cravings of foods are actually related to trauma. And so we can have cravings for sweets. We can have cravings for gluten. It turns out that breads and other gluten, um, the gluten molecule attaches to an opioid receptor in the brain, so that gluten actually can increase a sense of well-being in the body and decrease a sense of pain. So, like, my thing was I would crave like croissants and breads and things like that. I realized now it was probably part of my body's, the way that my body changed in reaction to the trauma. Some people will also have complete and total loss of appetite. When the brain goes into that trauma mode, it's the fight, flight, and freeze. There's no digesting and there's no resting. So that's why people can sometimes lose their appetite, or they can have diarrhea. The stomach and the gastrointestinal system want to evacuate themselves so that all of the energy is ready to run or fight. Okay, so getting into a few evidence-based practices here. This is not an exhaustive list. This is just 4 evidence-based practices that have the most research showing efficacy, that is, success in reducing symptoms of trauma. These, as I mentioned before, are interventions for trauma in general, not the specific kind of workplace trauma, which I think is very different than, say, if you're in a car accident or you survive a natural disaster. I think workplace trauma is different in part because there's relationship betrayal. Oftentimes we are betrayed by trusted colleagues, or there's institutional betrayal where the employer, who's supposed to keep us safe while we're at work, right? We trade our labor for pay, not for abuse. And according to OSHA, we're supposed to be in a safe environment that's not going to cause us bodily harm. And we know from MRIs, magnetic resonance imaging scans of the brain, that people who are exposed to workplace abuse, psychological abuse, actually end up with changes to their brain structure. It changes the amygdala, it changes the prefrontal cortex. So these evidence-based practices, and I'm about to share with you, do not address the relational issue necessarily, nor do they address the identity piece necessarily, that I think is also significant for workplace abuse survivors, because for so many of us in a capitalist society, personal worth is equated with work, right? Personal worth is equated with wealth. When we meet somebody, we are oftentimes introducing ourselves. Hi, my name is so-and-so. This is what I do for a living. Or tell me about yourself. What kind of job do you have? And so many people who experience workplace abuse end up going into silence due to stigma. They don't want to be seen as lesser than, as defective in some way. There's also a lot of stereotype out there about the people who end up being bullied and abused. Most of it is completely wrong in terms of workplace abuse, unlike bullying on a schoolyard, in a playground, or social media between youth. Oftentimes, those people who are bullied are perceived as weak or different, or they're targeted because they don't fit into the main group. It's the exact opposite with workplace abuse. Oftentimes, it is the person who has subject matter expertise, who's smart, who has emotional intelligence, gets along well with others, that is actually felt as an existential threat to an imposter leader, or a workplace bully who has a dark triad personality. So they've got sociopathy, where they injure others and they don't have an internal compass. They have no conscience, so it doesn't hurt them. They can go to sleep just fine after destroying a person during the day. Or they're a narcissist, or they have narcissistic personality tendencies, where they have a gaping hole in their sense of self-worth, and they are trying to make themselves feel better by hurting other people. Or they have Machiavellian tendencies. So they, in their a continuous drive for more power. They will punch down and kiss up with abandon to get to that power that they want. It doesn't matter who they step on in the process or what they destroy. They're going for it. So we need evidence-based trauma therapies, I think, specifically that address the identity piece as well as the professional wounding that can happen from workplace abuse. But in the interim, here are 4 evidence-based practices. I have multiple trainings on this topic, and I will go into them in more detail in the future. But what I want to highlight to you right now is that if you're a workplace abuse survivor and you're realizing that you're having a hard time focusing, you are crying a lot, you're quick to anger, you're having problems in your relationships or difficulty finding a new job, or you're having difficulty in your new job because you're being haunted by the traumatic memories from your previous job, you might decide that you want some therapy. A lot of people do not know that most therapists have not been trained in trauma therapy. They do not know how the brain literally changes its structure and function based on trauma flooding. And what they will do is end up trying to use interventions that are only accessing that prefrontal cortex when the amygdala is running the show, or they're not attending to the biology of trauma or to the nervous system dysregulation. And until we can learn to feel safe in our bodies again, it's very, very hard to work on processing our trauma. So the first thing I want to say is that it's really important. If you're going to find a therapist, make sure that you find someone who's trained in trauma particularly. Secondly, is you want to have an idea of the kinds of trauma therapies that are available and which might be the best match for what you're looking to do for yourself. So here are 4 interventions. The first is cognitive processing therapy, otherwise known as CPT. This is a great intervention, or can be a great intervention, for people whose workplace abuse impacted their sense of self. Maybe they have low self-esteem now, maybe they doubt themselves, they have shame, or they might have developed some moral injury. They are unable to trust other people or institutions. They have a sense that right and wrong has been capsized. Maybe they did right. They made a report that children were being abused, or they reported embezzlement, or they refused to participate in illegal behavior in the workplace as required of them by their abusive boss. And so that has left them with a moral injury. Or maybe they avoid reminders of workplace abuse. CPT might be a good match for folks who have those kinds of challenges. It's provided over 12 60-minute sessions. There are between session homework assignments. The activity is around writing a person's trauma story. And it can be delivered in a group setting, like a group therapy, or individual therapy when it's one client to one therapist. There's even an app, the CPT Coach app, that can be used. Prolonged exposure therapy, or PE, is designed to help people face the fears of reminders of the workplace abuse in their real life or in their imagination. So this can help people to have the ability to engage in their lives without having to isolate, without having to avoid situations or reminders of the abuse. And this is done through recording, a voice recording of themselves telling their trauma story. And over time, the fear reaction that happens when they are exposed to the reminder of the workplace trauma is extinguished or is reduced. Prolonged exposure therapy, it ranges between 10 and 15 90-minute sessions, so an hour and a half, and there is between session homework. These are in vivos, meaning that the person is exposing themselves in real life to the thing that they've been avoiding because it reminds them of the trauma, or they're using imaginal exposures. So they're using their own imagination to expose themselves to the stimuli that causes a trauma reaction. Over time, that pairing of the neutral stimuli with the bodily trauma reaction becomes weaker and weaker and weaker, so that eventually the person can be exposed to that stimuli and not have a full-on panic, anxiety attack, or what have you. Prolonged exposure therapy is done on an individual basis, not on a group level, and there is no app. Written exposure therapy also deals with extinguishing fear reaction, but this instead is by writing out their thoughts and emotions related to the traumatic experience. Over time, patients realize that their memories are not dangerous and they don't need to avoid those memories. Written exposure therapy is done in 5 sessions, 50 minutes apiece, and it involves 30 minutes of that 50-minute session is in writing. There is less dropout in written exposure therapy than cognitive processing and prolonged exposure therapy because it's a shorter duration of sessions and because it does not require the person going into detail about the traumatic memory. Written exposure therapy can be done one-to-one in individual therapy or in a group setting. And then finally, EMDR is eye movement desensitization and reprocessing. This is when a client recalls the trauma while they're paying attention to something that's moving from side to side. And this has to do with bilateral stimulation. So I shared earlier, left and right hemisphere of the brain. In between those two hemispheres is a corpus callosum. It's a sheathing that helps move the electrical impulses from one side of the brain to the other. And that's oftentimes disrupted by trauma. And so while a person is recalling their trauma, they're paying attention to a therapist's finger that's going side to side, left to right, or they're tapping on the left and the right knee or shoulder, or they're listening to a sound that's going from left ear to the right ear, left ear to the right ear. And so this EMDR is done over 6 to 12 sessions. They're 50-minute sessions apiece, and they go through an 8-phase process. This 8-phase approach starts off with bodily strategies to help the nervous system stay as calm and safe as possible. And that's a really important part of EMDR that for many people who end up with an overactive amygdala, it's very, very helpful to do those bodily or somatic practices first. EMDR is only done in individual therapy, not in group therapy. All of these interventions can be done in person or online. So in addition to these therapies, I want to also share with you, there are a few self-help trainings that are available through PESI. For any clinicians out there, you might be familiar with PESI because they do online trainings that you can access as a clinician for your annual continuing education units. They've also created a new set of trainings that's for non-clinicians, people who want to work on from a self-help perspective on their own mental health experiences of depression, anxiety, and so on. So the first is on the left-hand side of the screen, 7 stages of detoxing from toxic relationships, a guided support course with Jessica Baum. I really think that the detoxing of the relationship side of a workplace abuse, whether it is the colleague who betrayed you or the institutional betrayal from the employer or human resources who failed to protect you and instead focused on minimizing risk and liability for the company, detoxing from those toxic relationships can be helpful. Another training that might be of interest is healing after loss, tools for navigating grief. As I mentioned before, workplace abuse is involved with oftentimes significant amount of complicated grief and loss. People don't come over with casseroles and send get well cards. It is an ambiguous loss when our careers are catastrophically interrupted. And especially if we feel a sense of shame or we don't talk about it with other people, the loss is magnified oftentimes. And then finally, there's a session on integrative polyvagal theory for trauma, anxiety, depression, and more. This is a training that talks about how the nervous system, how we can engage trauma healing at a bodily level, and using the vagus nerve, which is the primary nerve that connects the brain to all of the organs and all of the limbs in the body, how we can engage the vagus nerve to help settle the mind and the body following trauma. These I'm not the trainer of any of these sessions. I do share them with people on behalf of PESI and receive compensation for sharing these. There are hundreds of trainings, and I just share the ones that I think actually might be of use potentially to people who have workplace abuse. The QR code, this is for a workplace trauma recovery resource guide that I have developed. And like with all resources that are in any of my videos or any of my resource guides or workbooks, these are provided for an educational purposes only. I make no claim about the effectiveness of any particular therapist's work or employment attorney's work, or even the outcome of using different resources. But I do share them because I know for myself in the beginning of my workplace trauma recovery, I didn't know where to start even looking. And my brain was so scrambled, it was hard to make sense of complicated things. I'm much better now thanks to the neurofeedback, but I thought, you know what, let me put together resources that I know would have helped me when I was first going through workplace trauma recovery. I am so grateful that you have spent some time with this video, and I would love to connect with you. So feel free to reach out. If you live in Ohio or in British Columbia, I provide online trauma therapy. I am licensed in the state of Ohio and British Columbia. For people who are outside of those regions but would like professional coaching, I provide support for professionals to pursue their own goals for recovering their careers. And then finally, I have a YouTube channel with interviews that I've done with employment attorneys and mental health providers and workplace abuse survivors. Please reach out to me on LinkedIn. I would love to connect. And I'm also on Substack. Thank you so much. Let me know if there are topics that you'd like to learn more about, or if you have any feedback about this video, I welcome to hear from you. Thank you so much, and best of luck in your recovery.